Support for this program is provided by the law firm of Henderson, Franklin, Starnes, and Holt, PA. Serving Southwest Florida for more than 85 years, Henderson Franklin provides a range of services, including business, tax and estate planning, healthcare law, real estate, and commercial litigation. Moorings Park in the city of Naples, offering independent living, assisted living, and skilled nursing at the Chateau. Enjoy the maintenance-free lifestyle with a wide array of services and amenities, all with the security of life care. Key Private Bank, offering a broad, integrated, and objective perspective on managing wealth with more than a century of banking, trust, and investment expertise. On the web at key.com/KPB.
Good evening, everyone. I'm Jim McLaughlin. Thanks for joining us tonight. Welcome to this special edition of Connect. Healthcare reform, three words that in recent weeks have evoked fear, hope, optimism, even a fair share of outrage in certain parts of the country. But here in Florida, the numbers of uninsured and underinsured are just staggering. According to Families USA, 3,500 Floridians are losing their health insurance coverage every week. An estimated 78,000 have lost coverage since the government began releasing statistics in March. And at least 1/5 of our neighbors are uninsured. That's the third highest rate in a nation where 50 million people live without coverage, according to the latest census figures. And most of those uninsured are in working families, and those numbers are rising. Now, following this broadcast, PBS is going to air a special report on healthcare reform. What's happening in Washington and Congress, and that big debate between supporters and opponents. Our mission here tonight, though, is to hear from you and to try to help clarify some of the questions you may have about the healthcare realities in our region. We invite you to call into this live broadcast as we try to tackle the tough issues right here in our own backyard in Southwest Florida. What are the problems unique to our area? The number to call is 1-800-809-WGCU or 1-800-809-9428. The question we want to know tonight is, how has the economic downturn affected your access to affordable health care in our region? Now, to help answer some of your questions tonight, we've assembled a team of experts from the healthcare profession in our area, try to answer some of your questions and examine our own crisis in paradise. Please welcome, if you will, Jim Nathan, President and CEO of Lee Memorial Health System. Jim, good to have you with us tonight. Nina Gray, CEO of the Neighborhood Health Clinic, serving the working poor in Collier County. Dr. Denise Heinemann, former Dean and Associate Professor in the Division of Health Sciences at Florida Gulf Coast University, and Lalai Hamric, President and CEO of Family Health Centers, serving Lee, Charlotte, and Hendry counties for more than 42 years. I want to thank each of you for coming tonight, giving up your very busy schedules and your priorities to come here and join us, try to help some of our folks out. Before we get into some of the questions and some of the topics, I want to try to start with sort of a clean slate tonight and sort of set the stage for what we want to talk about. Jim Nathan, I'd like to start with you. Give me a quick little 15-second or so synopsis of what you see as some of the major points that we might want to talk about tonight that we need to consider.
Well, Jim, thanks for doing this. Just as our nation is facing a massive economic challenge, we're facing the same in healthcare. The principal financing systems for healthcare are in disarray. Medicare will go bankrupt in the next 7 years. Medicaid is bankrupting each of our states. And the commercial insurance, the principal funding for health care, has been based on employer-sponsored health insurance, is dying each day, and there's nothing out there to replace it.
All right, Nina Gray, you deal with a unique situation, all volunteer organization in your clinic. Give me your little encapsulated version of what you think we need to talk about tonight.
What we're seeing is an increased number of uninsured and underinsured residents in Southwest Florida seeking health care, and will there be adequate resources for these individuals?
All right, thank you. And Dr. Heinemann, give us your overview.
I think access to care is absolutely important, and that's access to all levels of care. We basically have an illness-focused system, and we need to begin to look at access across the system, including prevention.
And prevention is going to come up a lot during this broadcast tonight. Lalai Hamric, from your position, what do you see as the overall topic that you'd like to discuss tonight?
Access and a shortage of providers. And when I talk about providers, this is locally and nationally. And that includes not only the physicians, but nurse practitioners, pharmacists, nutritionists or dietitians, all that go to make up the people that need to really care for total care. And primary care does include the prevention. They're the ones that tell you to get your mammogram. They're the ones that say it's time for your annual checkups and you need to do this and this. And that's where you stop a lot of things.
All right, prevent it now instead of paying for it later. With an unemployment rate of officially 13% in Lee County, we know that it's higher than that because of the number of people who are unemployed but who are not collecting unemployment. Jim, what do you see the biggest problem facing the working class folks in Lee County, many of whom have lost their jobs, lost their insurance? What is their particular crisis at this point?
Well, as I mentioned before, the principal way we've been paying for individuals that are uninsured or underinsured has been through commercial insurance, through the employer-sponsored health insurance, and there's been massive hidden taxes. But in our community, what we're seeing is that's in disarray, as we're a small employer community that can no longer afford to provide insurance. So we're now creating more uninsured, thereby creating an even bigger pressure on those companies that choose to provide insurance.
And Nina, would you agree with that from your perspective?
Absolutely, yes. It's the same.
All right, we have some statistics tonight to show you. We're going to hear a lot of statistics tonight, a lot of facts and figures, but it boils down to people, and that's what we really want to talk about tonight. In 2007, 35% of Lee Memorial Health System's patients had commercial insurance. In 2008, that number had dropped to 30%. So far in 2009, the number is about 28%. Realistically, that means nearly a quarter of the patients who go into the hospital are picking up the shortfalls from Medicaid, Medicare, and the uninsured, and this can't be an easy situation, Jim. Overall, the Lee Memorial, the percentage of patients at Lee Memorial who are uninsured is up 19% for the first 5 months of this fiscal year compared to the same period last year. And Lee County leads the state in increased Medicaid enrollment. It's shown a 25% overall increase. That's about double the state average increase of 12% in 2008. And again, Jim, the numbers that we'll hear tonight are staggering enough when you talk about the numbers of people who have lost their jobs, don't have health care, and so on. Put a face on this for us. What is the reality when these people walk through your doors at Lee Memorial or your affiliated hospitals?
They simply aren't in a position to pay for their care, their out-of-pocket expenditures, even people with insurance. A lot of the insurance now has moved to high-deductible insurance, and the individuals just simply don't have the funds available to be able to care for this. This is serious. It's rapidly becoming, it's a national problem, and yet we still have a lot of people feeling like, well, I don't want to deal with this because it doesn't affect me. This is affecting every single American.
And this is taking on the aspects of the hunger issue. Well, it's not my problem. It's those people over there. Well, those people over there are your neighbors, and it may be your son or your daughter or whomever. So it's affecting all of us. The downturn, the economic downturn, does not discriminate. It is affecting people of all ages and races, the poor, seniors, families, even former CEOs. People financially stable just a short time ago are now finding themselves unable to pay for insurance and just one major sickness away from potential bankruptcy. Like good friends, Jeff Thompson and Dr. Jim Taylor greet each other with genuine appreciation at family health centers. A quick checkup on the road to recovery.
I want you to have a seat here today.
Okay.
And,
Dr. Taylor saw Jeff through one of the most trying times of his life.
just like a 19-year-old. Nice and regular and in perfect.
It really is like the perfect storm, and there was so much going on, changing jobs, the mortgage crisis, that you will, or the bubble burst in the real estate market. I'm in the car business. The economy started with the downturn, and it's just It really is like a perfect storm, this confluence of everything happening all at once, and then to get sick on top of that can put you over the top.
Jeff had a nice home in a nice neighborhood, a wife, 2 young children. At 45, Jeff Thompson never thought he'd feel the effects of a heart attack.
One night I was driving home from a meeting and had shortness of breath, lightheadedness, a little pain radiating in my arm. It didn't subside. Ended up driving myself to the emergency room and was in the cardiac unit within 20 minutes. I was uninsured at the time.
Jeff didn't have a heart attack, but his problems were just beginning.
It was very frustrating. They kept me in the ICU for 6 days. Took a couple days to diagnose the problem and then a couple days to get it corrected where they could let me out. Even just laying in the hospital bed, I was aware that it was going to be a tremendous burden.
Jeff was 1 month away from full insurance benefits.
I was uninsured at that point because I had changed jobs, and there had been about a 2 to 3 month lapse in between. The COBRA payments were close to $1,000 for the family of 4. I thought that the window was probably okay, and I was looking forward to having the benefits. I had actually already filled out the paperwork.
But Jeff wasn't through the waiting period. To make matters worse, his thyroid seemed to be causing problems for his heart, and he suffered an adverse reaction to medication. Pain, swelling, a rash, a multitude of symptoms physicians couldn't diagnose. A desperate request brought him to Dr. Jim Taylor and Family Health Centers.
And he was found to have atrial fibrillation, what we call an irregular heartbeat. So he walks in with a walker. And I'm saying, okay, I understand hyperthyroidism. What does this have to do with a walker?
With Dr. Taylor's help, Jeff recovered within 48 hours. Many procedures later, he is well, but the financial toll will take Jeff Thompson years to resolve.
As far as the medical bills, I would have to look at you and say, I really don't see the light at the end of that particular tunnel. You certainly can't second guess it. Should I have not gone to the hospital because I couldn't afford it? No, I have a 5-year-old and a 7-year-old, so we'll do everything that we can to get through this.
If you are uninsured, you're really one significant disease or one bad accident away from bankruptcy.
And Jeff's story is just one of several stories we'll have for you tonight to put a face on the figures and facts that we're talking about tonight. We do want to hear from you. You may be able to hear the phones ringing in the background. We want to know how the economic downturn has affected your access to affordable health care in our region. Again, the number to call is 1-800-809-WGCU or 1-800-809-9428. We have a call from Dwayne in Fort Myers. We're not sure that we have the expertise here to answer this question because it's kind of a legal question, but I'm going to toss this into Jim Nathan's court here. Any legal recourse for somebody whose employer canceled insurance 1 day prior to the employee having surgery?
Well, obviously, they need to check with a specialist in employer law, but the reality is that if you're a small employer and you've got one major medical problem, each of the insurance companies look at it as an experience rating. Years ago, we used to look at health insurance from a community rating, so there was a broad population. Now they look, so if you're a small employer with 5 employees and one has a major illness, you now probably can't afford to buy insurance for the rest of your employees. Whether that was the case in this situation, I don't know. I've never heard of that happening, but it certainly is a possibility because of the impact for the rest of the employees in the organization.
All right. Now, Family Health Centers, which we saw featured in that story about Jeff, has been meeting the needs of the under and uninsured in Lee, Charlotte, and Hendry counties for decades, 4 decades to be exact. Lalai Hamric has served as president and CEO of Family Health Centers for 42 years, going strong. And
Well, the first 10, I wasn't the president and CEO. I was learning my job.
and you learned it well. You've helped it grow into a practice that now includes 12 medical and 6 dental offices. And Lalai, talk to us a little bit about how you meet the needs of people who don't have insurance but really, really need care.
Well, we like to think that we are the first entry to care, and how we meet it is we can see anybody and everyone. I mean, there are no real financial requirements to come to us. The issue is, though, most of the people that use our services have nowhere else to go, and they do not have insurance, or they are on Medicaid, and we meet it with a variety of let's call basic care. We have family and internal medicine physicians. We have 12 pediatricians. We have 3 OB-GYNs and 7 nurse midwives. And we have dentists and dental hygienists. And some
Now, these are all spread out among the offices, which are located all over the place.
7 nurse practitioners, not counting the nurse midwives. And so we take care of the whole family. And we now have pediatric offices. Some of our offices, we're down to about 2 offices that do family care. We've moved into more specialized areas of pediatrics in a place and family practice. But where we're not going to be able to meet the need is we're already 3 primary care adult physicians short and 1 leaving. That's 4.
And you started out in, I guess, basically providing medical care to
the farm workers.
Primarily our migratory
That's right.
agricultural workers, the farm workers. Is that still an underserved group today? Is that still a focus of a lot of your practice?
Yes, but if you know, there's not as much agriculture. And those very same people were doing the hardest work in construction. They were putting in the bottom floors, they were digging up the ground for it, they were putting the roofs on in the hot sun. That's what they were doing. We do have about 5,000, 6,000 agricultural workers. That counts their children in these 3 areas. But it's the very same people doing the hardest labor, and of course, they're unemployed.
And that's going to continue, no doubt, as the economy continues to get worse in some areas. All right, we have a lot of interesting information tonight. A study by Families USA found that insurance premiums grew 3.7 times faster than personal incomes for most of the last decade, and that left a lot of people feeling that healthcare costs were a real threat to their financial well-being. The CEO of Hope Healthcare Services, it used to be called Hope Hospice, Samira Beckwith, shares her thoughts on where we stand right now.
We are at a very critical time right now in this community, especially all across the country, but especially here because we're so hit by the economic downturn. We have more people in this community because of unemployment, because of people who aren't working as many hours, who have less benefits. And I really believe that we're seeing more people in hospice because they don't have access to regular health care. And I really think that the entire healthcare system throughout Southwest Florida is being strained by this economic downturn and also the fact that people's benefits have been impacted. We have people who are sicker, people who aren't getting the care that they need. I believe people are going to the emergency rooms more because they wait until they can't handle it anymore. They're not going for preventative care. So I think it's going to be years before we see, even when the economy improves, we're going to see people's health care come back up to the standard that we would hope it would.
And we have a call for Nina Gray from Doug in Port Charlotte, who wants to know how clinics such as the Neighborhood Health Clinic in Naples can be integrated into the national health care plan currently under discussion, which is bigger than you can possibly imagine.
It's a great question. Thank you, Doug. Essentially, our understanding is that free clinics similar to the Neighborhood Health Clinic are not included in the discussions about a national health care plan, nor are we invited into the discussions, which is frustrating for us because we are a very cost-effective operation. Typically around the country, $1 raise provides $4 in services. And at that grassroots level, we'd like to see more inclusion at the national picture.
All right, let's check our phones again. We've provided a phone bank for you tonight, as we mentioned, staffed with volunteers from community service agencies around the area to help answer your questions and to get the questions out to me. The number to call is 1-800-809-WGCU or 1-800-809-9428 if you'd like to share your thoughts and will tell us how the economic downturn has affected your access to health care. We'd like to hear from you. We have a question from Bert. In Naples, this is essentially for all of you. Since every panelist has a viable economic interest in cash flow from healthcare, who will pay for reform and how will costs be controlled? Dr. Heinemann, do you want to tackle that first for us?
I think we all have to pay for it. And I think it's when we go back to access again, it's absolutely important that we have a healthy population that can work and enjoy life. And I think we all, I'm my brother's keeper. I know that's not a popular way of looking at things, but I think this is a national concern. The status quo will not continue. It can't continue. When Jim talks about people coming to the hospital, they're not coming there when they actually should be there. They're coming later. We've seen an example here of someone who put off their care because they were concerned about not being able to pay for it. That raises the acuity level of that individual, makes their treatment more difficult and their recovery longer.
And I think, as we're going to see as we go through the program this evening, the old ounce of prevention adage pays off here. Prevention first to avoid the emergency room at Jim's hospital later that's going to cost
absolutely
an
But
astronomical.
we've invested the other way. We've invested on the repair
The
center.
illness base.
On the illness base. Right. Meanwhile, we've become the fattest nation in the world. And a lot of our chronic medical problems do have a direct correlation to obesity.
All right. Well, 10 years ago in Collier County, Nancy and Dr. Bill Lascheid founded the all-volunteer neighborhood health clinic and have received national recognition for their model of care. It is all volunteer. It takes no federal or state money. It offers life-saving medicine to thousands of people. People like Deborah Crease, who would have turned to the emergency room, as we just mentioned, at the highest possible expense when she got sick. The health clinic helped Deborah break that cycle of dependence.
All right, and let's just get your vital signs.
Life's been a real challenge lately for 52-year-old Deborah Crease.
Every dollar you make, now you sit in judgment of, okay, do I pay the electric this week or do I go get fixed? Or whatever's ailing me.
As a self-employed property manager, the distressed housing market led to smaller paychecks. Then, her son nearly died in a motorcycle accident, forcing Deborah to stop working altogether to attend to his medical care. Her own health was never a priority until the grandson Deborah's also raising got sick.
In the process of going to the emergency room to have him taken care of, the triage nurse took me aside and said, "We want to take your blood pressure." And after 6 takes of my blood pressure and 3 different nurses doing it, they informed me I wasn't dying on their shift. My blood pressure was 212 over 100 and something.
Acute hypertension, the very illness that ultimately claimed the life of Deborah's father.
So the process of going to the hospital, at that night, I received my first prescription for blood pressure meds. But again, they give you 10 pills and a list of referral doctors. These referral doctors, all 6 on the list, ranged anywhere from $300 to $500 for the first initial visit. That did not include the meds. I'm in a catch-22.
Deborah couldn't afford the appointment or the medication. Her high blood pressure brought her back to the ER 3 more times before a nurse suggested the all-volunteer neighborhood health clinic, serving the working poor.
And I was working 2 nights a week where I'd have a lady come in and sit with my son. So by the skin of my teeth, I actually qualified to get in here. And they have been absolutely phenomenal for me.
With affordable care and medicine, doctors resolved Deborah's blood pressure problem, fixed a carpal tunnel issue, and biopsied a lump in her breast, which turned out to be benign.
I may not know all the names of the people here because there's so many that volunteer, but they not only give of their time, They give their heart. There is a smile on every single one of their faces when you walk in, no matter how bad your day is, how horribly you feel, or that you may not even have the $20 to give. This clinic has just done everything for me and a ton of other people that I see walking through these doors. They give of their heart, they give their time, they care, and it shows in every single one of them. And I just want to say thank you. Hi.
Obviously, Deborah's clearly grateful for the medical care and support she received at the Neighborhood Health Clinic, and Nina Gray, as we've mentioned, is CEO of that organization. I mentioned earlier that Nina is a familiar voice, now a familiar face. You've appeared on my Gulf Coast Live Connect radio show on Mondays a couple of times. You were there just yesterday, I believe, to talk about this. Tell us how your clinic offers medical care to people who are still working, still have jobs, but don't have insurance.
I think Deborah Crease, in the piece we just saw, is a typical example of a neighborhood health clinic patient. She's working, low income, uninsured, she has serious chronic illnesses. She came to the neighborhood health clinic and we're treating her illnesses, we're entering her into a healthy lifestyles program, we're moving more into a prevention mode, but our patients do have to be working and do have to be low income and not have insurance. And they have to be an adult in Collier County. So we've taken a small niche market, and that's the group that we're providing health care for.
And that small niche market is growing incredibly.
And as I said before, in the last 8 months, our increase in new patients is 40%. And that's huge for us to accommodate. Thank goodness we have so many volunteer physicians and nurses and other healthcare providers.
All right, the two things I want to talk about right there. The increase in patients, you're seeing a new type of patient now.
Yes. It's the new face of the working poor that we're seeing in Collier County. These are folks who had their own businesses, who can no longer afford health insurance, their profit margin is down, they can't afford to insure their employees. People who had good jobs and lost them, now they're working part-time, they have no benefits. We have patients who never expected to be neighborhood health clinic patients and professional people.